Hello, everybody. I wish I could be there with you, but I'm happy to participate through this webcast recording, and I'll give a few thoughts about the importance of the PREVENT study. It was the first community randomized trial for STD control that examined these things. It looked at multi-component interventions that had both biomedical and behavioral interventions, and these were integrated and coordinated, and that hasn't been seen in previous community randomized trials. And then the impact on all of the major curable STIs combined was the outcome. And this study involved major cities in Peru, not small rural villages, which has been characteristic of previous community randomized trials for STI control. And it involved both high-risk populations of female sex workers and men who had sex with men, as well as the general population, both in terms of measuring the impact and the focus of the intervention. And then this occurred in Latin America, not in Africa, where other studies had been conducted. This was a landmark study because of several factors. It was very rigorous, random baseline and follow-up population samples to assess the impact of the intervention. And that's important. Secondly, it involved rigorous pairwise randomization of cities, where cities were matched in terms of population size and region, and then further the statistical analyses of the impact were adjusted for baseline prevalences, which differed sometimes, even though these cities were paired. This was the first community randomized trial to show an impact on sexually transmitted infections in female sex workers. Amazingly enough, it hadn't been looked at carefully before. It was the first to show an impact on multiple STIs in the general population of females, although not in the general population of males. This was the first time that national surveys of major STI prevalences, 8 STIs in the Peru PREVENT study, were undertaken in random samples of the general population of young adults, in female sex workers, and where these STI data were linked to socio-behavioral variables. And these socio-behavioral variables were assessed by people responding to questions on PDAs to reduce stigma rather than in face-to-face intervals. And this allowed us to study not only who had the STIs, but what were the major risk factors for those STIs, since the risk factors were very carefully studied in this PREVENT trial. Finally, it was the first community randomized trial ever conducted anywhere to show a significant impact of condom social marketing at the community level, and also to study a health communication campaign for STI HIV prevention and to show an impact of that. So you're hearing a lot more about this study, but the major conclusions from this study were, first of all, that this was actually feasible, and secondly, that it effectively did reduce rates of STIs in female sex workers and in the general population of young women, although not in men, for reasons that you'll be discussing. The study participants and the implementing teams were very enthusiastic about the intervention. They bought into it, they liked it, and they really were happy with what was taking place. The next thing was that syndromic management training greatly improved STD syndromic management in pharmacies, where a large proportion of people in Peru go for STD symptoms, and when seeing clinicians. Female sex worker condom promotion was effective when it comes to condom use with their clients, but a big problem was that it is not effective with non-client regular partners, something that will have to be addressed in further work. An amazing fact was that females sought treatment from pharmacies 10 times as often as males, and this is termed the medicalization of females, who much more often sought care. Next, as I mentioned earlier, condom social marketing and health communication campaigns had significant impact on the direct variables that were studied, that is, increased use of condoms with casual partners and better recognition of what symptoms STDs caused and where people should go to get treated for them. The cost of this study was fairly modest. It's attainable in most low to middle income countries, or low middle income countries like Peru. Another interesting fact was that the centralized testing of specimens collected from sex workers in the cities around the country was feasible. It was possible to collect the specimens, ship them every week to Lima, where they were tested in the laboratory, and then the results were immediately emailed back so that it was possible to get treatment to sex workers within a week. However, follow-up for treatment was only moderately effective. Many of the women couldn't be found. Probably they were mobile or not practicing sex work certain periods of the month. So, and then lastly, the high rates of HIV and syphilis in male sex workers made it clear that this is a high priority, perhaps the highest priority for HIV and syphilis control in Peru. The study has had impact in many ways, some very important publications in The Lancet and in PLOS journals. I just attended the first meeting on the next iteration of the U.S. STD guidelines, and the PREVENT study will be included as a population-level intervention. This is still pending. And in terms of lessons learned, this book that has been supported by Cesar Nunez and UNAIDS is a great example for how data can be shared and describe some of these lessons learned. There were certain factors that were critical for success of the program. The first was leadership. The leadership from Peru included Patty Garcia, who was the overall principal investigator for Peru, but others there, Cesar Carcamo, Pablo Campos, Marina Chiapi, all made key contributions in the areas that they were responsible for. And others in the United States and the UK also were very effective leaders in their areas. There was real authenticity for this study, which is, I think, why it got funded in the first place, but also why it was carried out so successfully. And by authenticity, I mean that the team had a long history of collaborative research before the study was ever undertaken in Peru, studying various aspects of STI and STI control. Third was the effective international partnerships. It's unusual to find such good collaboration between universities, and several were involved here, funding agencies, several were involved, ministries, several ministries were involved, non-governmental organizations, and these public sector organizations worked with the private sector, for example, with physicians, clinicians, and with the pharmacies. Also important was the interdisciplinary collaboration, not only involving clinicians and epidemiologists, but also those actively involved in public health, microbiology, informatics, biostatistics, policy, economics, and mathematical modeling. So this bringing together an effective collaboration of various disciplines was critical. Community participation was also important. That is, the risk groups themselves, the high-risk groups of sex workers, the managers of the institutions or facilities where they worked, local jurisdictions and authorities, the SERETS clinics, all of these were important and collaborated well. And the funding agencies included the Wellcome Trust, the National Institutes of Health, USAID, NAMRU number 6 in Lima, and in putting this report together for all of you, UNAIDS. So with that, I'd like to thank everybody who worked on this study and all of you for this very nice summary for everyone of the PREVEN project. Thank you very much.